actually took the vaccine. Well, I was against it for like the longest because it just came out and like, what do we really know about it? But I had to take it because I realized I have great grandparents. So it's not like they're my grandparents, they're my great grandparents. And I can't risk them getting sick or anything happening to them. And like, say if they were in the hospital, I wouldn't be able to visit them because I don't have the vaccine.
Dr. Kazmithia Corbett, one of the scientists who played a key role in developing the Moderna coronavirus vaccine. She's a senior research fellow at the National Institute of Health's Vaccine Research Center, and there she is. Doctor, thank you so much. I'm saying thank you because that vaccine you developed in my arm. Thank you for that.
Thank you for getting vaccinated.
Absolutely, I will. Do you think we're doing better? That was a big concern, and we're still seeing some of that hesitancy, in particular with the African-American community about the vaccines and getting the vaccines. That was a big push of yours. Is it getting better, that hesitancy going away a little bit?
Well, you know what, TJ? I actually like to change the narrative a little bit, and instead of calling it hesitancy, I call it vaccine inquisitiveness. And you know what? It is getting better. People have questions, but they are seeking the answers in the right place.
Has anyone taken the vaccine?
Yes, I took the vaccine because the doctor had told us that it would be best if me and my mom and my stepdad got the vaccine.
I actually took the vaccine. Well, I was against it for like the longest because it just came out and like, what do we really know about it? But I had to take it because I realized I have great grandparents. So it's not like they're my grandparents, they're my great grandparents. And I can't risk them getting sick or anything happening to them. And like, say if they were in the hospital, I wouldn't be able to visit them because I don't have the vaccine. So
yeah, I just kind of had to because like my mama said you got to, and because I wanted to go to school and get grades and stuff. So like yeah.
I agree with Faith because I was against it for like so long. I was like, what's the point of getting it if it's not really doing nothing? Like, because it's like barely stopping the chances of you getting COVID. Like, you can still get COVID with the vaccine, but I still got it because I didn't want to go back to school. I was tired of being like a little lonely. I wanted to be interactive and stuff. So, but do y'all know anyone who's like also against it, like all the way against the vaccine?
My father actually is against the vaccine, which is crazy to me because he don't really have a reason. He just make up stuff, so he's manipulative to me about it. So like he just make up random stuff to why he won't get the vaccine. So
I know my mom got vaccinated to keep her job, but me personally, I just wouldn't get vaccinated. I don't plan on getting vaccinated unless I really have to. Like for my career and everything, if they force me to get vaccinated, of course I would get vaccinated. I'm not against it, but it's just something I'm not wanting to do.
I actually have a question like for you about that. So like my mom she made a comment like for us, like you're a junior, like you're getting ready to like go to college. I'm a senior. So she was basically saying, what if colleges forced us, well not forced us, but like it made it a requirement to get vaccinated to actually like go like on campus instead of staying online, because now like everything is like back on campus.
I think with me, it depends. Like I would really consider taking all my classes online, even though I hate online school, and I'm against online school personally. But I'll just say I most likely would get my classes online.
Well, me personally, my mom made me take the vaccine because the Jaguars offered me a job and she just didn't want me to turn it down. So she basically signed the permission slip against my will and then told me to go to school and get the vaccine. So yeah, that happened.
With the people who got the vaccine, like what was our like biggest fear about getting it? Like was it like getting sick or like what?
I think my biggest fear was
actually getting COVID instead of like getting away from it or whatever, or getting any other type of sickness because I heard of it. So yeah, that was really mine.
I definitely agree. My biggest fear was actually getting sick, which I actually did, but not like as bad. I just got like a few sinuses and like some coughing. That's it. But like that was my biggest fear.
So my biggest fear is like something going wrong, because usually a lot of times the vaccines takes like 8 years to develop, but this was like a couple months or something. So it was still experimental. So I thought something was finna like go wrong, like my arms finna like fall off or something. So yeah.
One of the things, again, that a lot of people do not know is that we had extensive work on other coronaviruses that led us to have a portfolio of data and also patent pending technologies that allowed us to monopolize on those and move very quickly. So from the time about 2013 until 2019, we studied coronaviruses in so many various different directions in order to really understand how to make a really good vaccine to them.
My biggest fear wasn't actually getting the vaccine, it was the long-term effects of it. Because I know a lot of people are like, oh, well, you have to get a booster. I'm like, if we got a vaccine, why do we have to get a booster? But I don't know, like later down the line, we don't know what this vaccine may do, especially now when they're saying like pregnant women, they had a lot of miscarriages getting the vaccine and stuff. I don't like plan on it right now, but like 5 years, 10 years down the line, I'll hope to have children, and what if I can't because of the vaccine? So it's like a lot of what's, whys, and how is this going to affect us in the near future?
This messenger RNA cannot alter your DNA at all. It's just not how it works inside of your cell. There are also absolutely no fertility effects as resulting from getting this messenger RNA vaccine, or actually any vaccine for that matter, and no death.
Okay, my biggest fear was like the reaction, because like no one clarified what exactly was in the vaccine, and it's like, well, what if I have like an allergic reaction, and this could possibly make me end up in the hospital looking just as worse as the COVID patients do. And like and the thing is, I always felt like COVID wasn't even gonna come towards me because I was still wearing a mask all the time, and I felt like it was like low-key no point in getting the vaccine if I'm still doing what I need to do to keep myself safe. And with the vaccine, it's like you still have to wear your mask. And I'm like, if I get the vaccine, I want to be able to not have to wear my mask because it's supposed to be protecting me. Because that was like my initial thought about the vaccine, because I'm like, if I get the vaccine, since I have to, then I can keep my mask off because it doesn't really matter to me as much as it should, because I am protected in a way. Like you not getting a vaccine would be something that's somewhat like, not peer pressure, but like something that your peers also agree with you on, because like I know that it's kind of easy to say that you don't want something when you have other people who also agree with you. So was it like something that your peers also agree with, or is it just you that feels that way?
Personally, that's a hard question because I know my whole family's vaccinated except for me, and with my friends, one of them was forced to get vaccinated because they was going out of town and they had to. My other friends, I never asked if they was vaccinated, but I know most of them are getting vaccinated, so it's more like a me thing. And I always told them, like, even though I'm not getting vaccinated, if you want to, go ahead. But sometimes I do make jokes and everything, like, oh, you'll probably turn zombie like in 20 years. But it's just jokes and everything. But no, I don't think I influence anybody to not get vaccinated.
Do y'all actually think that like long-term effects due to like having the vaccine could end up like some type of apocalypse with like zombies or anything? Like, even though it's not like a whole joke, but
Okay, zombies, no, but like, you know how people that have chicken pox, like they have like, I don't know what it's called, but like now they found out you can get like a disease like from with your skin from it. I feel like it's gonna be something like that, like, yeah. Like it's but no, honestly, like I feel like it's gonna be something down the line. Like with the flu shots, a lot of people were like, oh, it's causing like Down syndrome and stuff like that. I'm like, okay, yes, like read the news. Yes. Like it was like a big thing like a few years ago, and I was like, oh my goodness, like this is crazy. So you really don't know what you're taking, but it's supposed to be keeping you safe. Like the other day, they were like, oh yeah, the COVID vaccine had a little bit of COVID in it. I'm like, wait. wait. But I feel like somewhere down the line, it's going to be something like, yeah.
I actually agree, because you know how like on commercial, you could be using a product like forever, and then like a decade later, they be on commercial say, oh, if you ever had this back in 2020, there's a chance. yeah, Johnson baby powder, how like, because that's one thing we used on babies, and then like years later they was like, oh, if you ever use Johnson baby powder, there's a chance you could get ovarian cancer. Yeah.
Okay, with that like mutation question, do you feel like taking further vaccines for like, say if like measles or like the flu shot, do y'all ever feel like it could actually like interfere with like the COVID vaccine causing anything else or like other sicknesses?
I mean, it seems like every shot we get, they're like, oh no, it's supposed to protect you, and then like something's always wrong. Like, I don't know. It's like it feels like we're protected, but not for the long run.
I also feel like that something might interfere with the COVID vaccine. I feel like I'm not gonna read the fine print of it and just like do something I'm not supposed to do, like something, and then I'm gonna end up getting sick. So like,
I agree. Like, I don't fully trust the medical system for good reasons, but I agree with Faith. Like, what if down the line, you take something else and it interferes with that, even though you already had it, and the next thing you know, you're in a hospital bed dying, don't know like what it is, and they'll be like, oh, this mixed with the vaccine you took a few years ago, yeah, you're dying, and that's why I really don't trust it, because it's like it's only a for, like, I feel like medicine in general is always a for now and never for in the future.
But these numbers actually come with the statistician's approval, right? And all of these things, each, whether it be the number of people that the vaccines are tested on, the doses of the vaccines that are given to the children versus adults, all of these little incremental details are tested and tried and true, and they must stand the test of time.
So like with the vaccine, do y'all think like this booster is actually going to help us? Like,
I feel like it's another dose, but advertised as a booster, as if it's going to help even more. Like, if anything, it's just a higher dose of the actual COVID vaccine. I don't think it's like anything. But I feel like, but if they're like with the booster, like what's even in it? Like, is it Moderna, Pfizer, or another Johnson & Johnson where we can all get cancer or something? Because that's what honestly worried me most about getting the vaccine with the different versions, because like you got the flu shot and that's just it's one only version, but when you have COVID, you have 3 different versions and it's not even available to everybody. And it's like, imagine taking Moderna like at the age you are now and like practically almost dying because it's like too much for you or something. Like, it just makes me think, because it's like medicine isn't trustworthy, like Valencia said, because like nothing's ever like permanent when it comes to medicine. You always end up having to take more and more. But yeah, like, have you ever felt like at some point if the COVID vaccine could, like, this sounds weird, but like bring some type of high to you, like as if you're getting hooked onto drugs, because with all these boosters that they're like creating, and it's like you need more and more, and it's like what does it mean, kind of?
I don't know. I hope it's not going to be like a addictive drug, because it's supposed to help us. I hope we don't have to have another booster, but it seems like we're getting it like 6 months. Like, I had my vaccine, like I got it in like August, and like now they're talking about a booster. I hope we don't have to get it every 6 months. Like, you know, that would be crazy for us to get a vaccine that we thought is supposed to protect us but now it's like it's like the opposite because we got to get more and more and more of it. So I hope not, actually.
You're getting what's called messenger RNA.
Okay.
So it is, and what it does is it sends a message to your cells to make a particular protein, which is called the spike protein that's from the virus. So you're not getting any other thing from the virus except for one protein. And you know, I've heard it being described like a Snapchat message, and I think that's probably the best description. So imagine your cells getting a Snapchat message with the spike protein, and for, you know, several hours to a day, couple days, it's reading that message and making that protein. And then your body says, as it's trained to do, well, you know, we have this foreign protein over here on these cells. Let's go over there. Let's see what it looks like, you know. And so your body learns what that protein looks like. And then so your body can create a very, very, very specific, on like the atomic level, immune response to it.
I want to get your opinion on the mask, because I know the mask, even though we're supposed to wear masks and everything, it also is causing us harm, because we're supposed to breathe out carbon dioxide, and with us wearing masks, unless, well, you know, some people have 10,000 masks on, but it's causing us not to breathe out fully carbon dioxide, which causes it to go back into our lungs. So what's your opinion on the mask?
I think that they're helpful, but they're also not helpful, because because sometimes at my school, sometimes our teacher has to like let us outside so that we can like pull our mask down to actually like breathe. Because I remember one kid like couldn't breathe in our classroom, and I think that it's helpful, but it's also not helpful.
So honestly, I think the masks help, but at the same time they don't, because like I've been lightheaded a couple times from these masks, but like I also appreciate the fact that they're like protecting others. So I like the mask, but then I don't, because like it's making me lightheaded from the carbon dioxide and stuff. So yeah.
Sometimes I agree to disagree, but I also agree with what you're saying. But to piggyback on your comment earlier, I do feel like sometimes it's just you want to be able to breathe, but at the same time you don't want to risk catching it from someone actually being next to you. Like, I get what you're saying, like, yeah, I be wanting to breathe sometimes, but at the same time I don't want to be able to put my mask down for 1 second and trace the contact and I have COVID, you know. But I actually have a question about that, like, once everybody get their comments out the way.
All right, I'm just going to go ahead and put it out there. I hate masks. I mean, like, I know it has good intentions, but I hate it. Like, if I don't have it in class, for some reason my teacher writes a dress code referral. Like, I forgot my mask at home, but where am I supposed to get my mask?
I do agree to disagree. It's kind of like a battle with, like, either like fulfilling your needs versus protecting yourself from like others, because you don't even want to catch COVID at all, but like you really just want to breathe freely like you were always able to do before COVID even existed. But at the same time, I do feel like they're somewhat pointless, because like at a point I felt like they were just covering your faces. They weren't really stopping anything. But then with like seeing like the actual results from like mask mandates and stuff, they're actually like showing some type of progress rather than without masks. But at the same time, not everyone's gonna wear that mask. Like half of the people at school don't even wear their mask properly, but you don't even see everyone catching COVID at the same time. So it's kind of like a hard question to even answer whether you agree or disagree, because you're still gonna wear it to kind of protect yourself, but you don't even like wearing it because it's uncomfortable and it causes like a whole lot of things like acne, and like you don't even want acne half the time. Like you want to look pretty without your mask, but then like having it on is like what I'm supposed to do if it's barely protecting me with the little amount it has.
Everything that you just said about yourself is true about yourself. But what about your neighbor who you might walk past in the street? Or like, what about your grandma who you want to go visit who might not have been able to get her vaccine? Or it's about community. From my perspective,
the informed choice to get vaccinated is outside of yourself and around community service, especially at the point at which we are now, where, we're in a pandemic, and we need to really get this virus under control so that we can get back not just to normalcy, but just sanity. And what the other options are, I think that when you not just step outside yourself, but also say, okay, well, I'm not going to get vaccinated because of this and this and that. And while I respect those choices, I think that a lot of times people don't look at what the other option is, which is you will forever be vulnerable to this virus. And that's something for me that's really deep to say out loud. And so I just want people to, number one, stay informed, because if you're watching this, that means that you are taking some onus over the information regarding your health in this vaccine. And then number two, to step outside of themselves and realize that this vaccination is, sure, probably going to prevent you 94% less chance of getting COVID disease. But beyond that, you are being one of those dead ends, so to speak, in the community around transmission. And that's almost more important.
Do y'all think even with the COVID vaccine that it feels like you low-key got COVID? Like, have y'all ever been like, oh my goodness, I can't breathe out of like my one nostril, or like, oh my goodness, can I taste something? Like, that'd be me.
Wait, because like I actually did, because like it kind of like ties into like a whole like conspiracy theory, like with the booster. Like, what if the booster is actually like we actually have COVID, but the booster is there to like fight it back just a little bit, so it won't be obvious that you have it. So it's like, well, what if everybody does have COVID and it's just like rarely discovered? You don't like.
I feel like it's kind of like a flu, like the flu situation. Like anyone can, anyone. I feel like we all deep down have the flu inside of us. Like anyone, it's just flu isn't talked about, recently because certain, specific situations. But I know with a vaccine, you can still catch COVID. Because I know, like, with my cousin, she got vaccinated, and she actually caught COVID. Her symptoms wasn't that bad, but she still caught COVID. And I know from unknown sources that I cannot name if I want people to keep their jobs. Like some of the hospitals with the patients and everything, yes, they have COVID. Most of the hospital who is vaccinated, most of the hospital who have COVID is actually vaccinated, other than the part that's not vaccinated. I think that personally come from people when they get the vaccine, they think, oh, I can't catch COVID, so that they're not taking as much precautions. Because I feel like just because you got the vaccine, you could still be asymptomatic and you can still spread it to other people.
What would make you feel safe enough that, like, what would make you feel comfortable having the vaccine, or what would make you feel comfortable enough to get the vaccine?
So honestly, I've never felt comfortable with any vaccine because I've never liked the idea of shots anyways, because it's like a metal going to my body, like, what are you doing? But I honestly feel like it's too late now, but I honestly feel like what would have made me feel more comfortable if they would have spent more time developing it before they released it to the public. Like, I know like millions of people are dying each day, but like, that's scary. So like, that would make me feel more comfortable if they spend more time on the vaccine than they did, because like, it's still experimental. Like, what if like my brain cells like explode or something?
I would like to know a little more about the booster that sometimes people are taking. And also, yeah, like I agree with Miles. I think that it should have been a little more developed more before you actually take the vaccine. And that would definitely made me comfortable.
I don't think nothing would make me feel comfortable. The only way I have to get it is if I'm forced to. Like, if I'm gonna do something, they say you have to get vaccinated, you gotta do what you gotta do to live. But I personally, who knows how long they spent the vaccine? Because I feel like as soon as COVID came out, like 2 months later, they was already talking about vaccine. So did they already have it in making? We just don't know. But I feel like I would say like a few more years I won't take the vaccine. But I think in general, at the end of the day, there's different versions, which is crazy for it to be a vaccine. We don't know how long they actually been spending on it. We don't know what's in it. I feel like even in the future, I'm still not going to be comfortable taking the vaccine unless I just have to.
For me personally, I think it's the nurses. Like, whenever you're about to get in the chair, they tell you a few facts about it. Well, at least at my school. And, like, they'll try and soothe you, calm you down, like, tell them that'll be, like, a quick sting. And that kind of, like, soothes me when I'm in the chair because I'm not a big fan of needles. I never have been. I probably never will be. And I guess that kind of soothed me a little.
For me, it honestly it kind of takes a lot more data because I really haven't heard about like anyone who's actually had like severe symptoms to COVID and actually surviving because they got the vaccine. I've only heard people that just die from it, like if they just have COVID, or if they had COVID, the symptoms weren't really that serious and the vaccine did what it could and helped them better themselves, but it's not enough data for me to even feel like even if I got COVID that I could possibly be okay to survive or not have like as bad symptoms as it would be like just having COVID itself.
In Florida, as of October the 15th, over 57,000 people have lost their lives, COVID-19. Over 2,600, almost 27,000 people lost their lives right here in Duval.
Thank you for watching EmpowerMe.
And thank you to our sponsors, the law firm of Farrah & Farrah and the Dolores Bar Weaver Fund.